blessed good afternoon and welcome to our first compliance officer certification program here in the territory. And this program is being brought to you by the Office of Emergency Medical Services Regulatory, a newly formed arm within the Department of Health, whose responsibility is to regulate emergency and non-emergency ambulances, to issue license, to investigate, and to do ambulance inspection, along with assist the EMS agencies in the territory to make sure that they are compliant and that we can help them to meet all federal mandates. I am Ms. Jacqueline Greenwich Payne, and I serve as the director of the Office of EMS. And so today, I want to introduce paramedic, attorney, Steve Wirth, and he's no longer a continental person. He is a Virgin Islander, and so this is his 4th trip, and he's been coming here for 12 years to educate us and anything that we can think about in terms of being in compliance with EMS. And I'm going to let him tell you a little bit about his organization, and they're the only organization in the world that does what we are doing here in the territory. And after we talk to Steve, I'm telling you, it is a blessing to have a leader that is leading from in front. And today we have with us our Deputy Commissioner, Harriet Charles. And she's also going to be telling you a little bit about her role here, because she's the Deputy Commissioner that's over compliance and regulation within the Department of Health.
Well, thank you, Jackie and Deputy Commissioner Charles. It's great to be back in the islands here the 4th time. We're very impressed with the dedication of all of the folks involved in emergency medical services here in terms of training and quality assurance and education. And the training we're doing today is called the Certified Ambulance Compliance Officer course. And that's a very good course to have here for the newly formed Office of Emergency Medical Services, because you're going to have the oversight over the EMS operations to make sure that the bottom line is that the patients are treated with the highest level of emergency care possible. That's what everybody is interested in. And this course is going to cover a lot of different aspects of that in terms of legal compliance, ethical compliance, dealing with how to conduct investigations if there's concerns or complaints, ambulance inspections, the whole 9 yards of what an oversight agency needs to do to ensure that EMS is provided in the best possible fashion. And that's really what it's all about. So we certainly commend the U.S. Virgin Islands for the initiative here. Like I said, you've already been an example for others to follow, because you've really been dedicated to training and education. Last year, we did the Certified Ambulance Documentation Specialist course, which was an absolutely excellent course to help improve emergency care documentation. Our program, our company, is the National Academy of Ambulance Compliance, and we provide these certification programs for ambulance services and state EMS agencies around in all 50 states and U.S. territories, as we like to say. So it's great to be here with this dedicated group of healthcare practitioners really doing the best possible job you can for the patients. And that's really what it's all about, to make sure that the patient's needs are met and that we're providing them with the best care. And that's what this commitment that you all have exhibited here through this course is doing. So thank you for being here, and it's great to be part of the program.
Hello, my name is Hadia Charles. I'm the Deputy Commissioner at the Department of Health. I have oversight over the EMS State Regulatory Office. Today we're conducting our first compliance training. We are making sure that our staff is armed with the knowledge that they need so that they can educate before we regulate.